I'm here with Professor Olle Ringdén, who has come all the way from Stockholm to visit us in Dubai and to collect his award for cancer research. Welcome, Professor Olle.
Thank you very much. It's a great pleasure to be here, and I'm really honored to get this award.
Wonderful, very good.
Yes.
And so what is it you've been doing within cancer research to win the award today?
Yes, I've been doing stem cell transplantation, and that is a well-established treatment for leukemia and other cancers. And there's one, you give them healthy stem cells from an individual. And one problem is that these cells can attack the patient. And if it's very bad, then it can kill the patient by damage to the gut, the liver and the skin. And what I've done is to use a new type of cell therapy. We have in the body something called stromal cells, and we have them in the bone marrow. They are in all tissues, but they are very rare. But you can expand them plentiful. And I became interested in those cells because they are immunosuppressive. And they also have the possibility, if you inject them IV, they home to damaged tissue. So I was the first to treat a boy that was deadly attacked by the immune system from the donor, with the gastrointestinal tract was absolutely demolished. And then I tried to use these cells. So I injected such cells from his mother, and within a week these cells healed his whole gut, and he could later on be discharged from the hospital.
Wow, so life-changing stuff.
Yes, but this treatment wasn't as good as we had hoped. So some patients were cured, some were not. So then we decided to look for other sources of cells. So then we tested cells from the placenta, and the fetal membrane protects the fetus from the mother's immune system. And these cells have also been used in Africa, or these membranes have been used in Africa to treat burn injuries for 100 years, and with a healing effect. So I thought that these cells much be better than to take cells from the bone marrow or other tissues, fat or so forth. So we started then to examine the cells from the placenta. And then we found that those from the maternal cells from the fetal membranes were those that had the best immunosuppressive therapy. So we used these cells instead. And then we found that these cells could also cure this attack from the immune system against the patients that were treated for their cancer, and that it could cure it. And now we have improved the technique. So now it seems that we have a cure for this life-threatening disorder that can happen in cancer patients that have a stem cell transplant.
And do we have to wait long for this treatment to become universal?
No, I mean, we can start tomorrow.
Oh, it's good to know that I have this plan.
Yes. If you have collaboration with gynecologists, because the placenta after birth is thrown away. So it's we really use something that is sort of thrown away, and we use it to help. Yeah.
So effectively recycling in a very
yes,
high-end
really recycling,
manner. Yes.
really recycling. So
well,
yes.
Congratulations to you and to your research, and thank you for the work that you've done. What does winning the Hamdan Medical Award mean to you?
It means a great lot. You know, I feel really honored, and I'm really very happy. And I brought my wife here to celebrate with me.
Please do enjoy the celebrations. And what does it mean? Does it propel you forward to want to do further research?
Yeah, of course I will continue, and we're going to use these sorts of other things. And it's been very rewarding because these cells, when you inject them to a person, they first home to the lung. And as a matter of fact, a couple of months ago I was on duty, and there was a young man that got an infection, and he got this shock lung. It's a white lung, and in stem cell transplantation they all die from it. So we injected these cells to him, and they all went to the lung, and they healed his shock lung. So he recovered, and 11 days later he was discharged from the hospital, and now he's alive and well home. 9 months after this procedure, and it's sort of a miracle. And I think it's very rewarding to be able to do something new and help people.
I can't imagine how rewarding that must be. And would you like to dedicate this award to that gentleman or to anyone else in particular? Would you like to dedicate the Hamdan Medical Award to the gentleman that you helped or anyone else in particular?
Well, then I would say, no, that specific treatment, I dedicated that to my mentor, Professor Groth, because he was the one that persuaded me to work in this field.
Fantastic. So your background's always been in oncology?
No, I was a transplant surgeon initially.
Really?
Yes.
What made you bridge the gap into working within oncology and treating cancer?
It was my mentor who was a transplant surgeon, and he told me to go to Donald Thomas in the United States. He was a Nobel laureate because he was the one that invented stem cell transplantation to treat leukemia. So I did a postdoctoral in Seattle with Donald Thomas.
I think we're all grateful to you that you did. And if you'd like to send a message to Sheikh Hamdan bin Rashid Al Maktoum with regards to the award, what would you like to say to him? Well,
I would like to thank him because this really encouraged us to do even better.
Fantastic. Thank you so much. Shukran, Professor Ali.